So I'm a nurse practitioner. I'm conventionally trained, but I can write prescriptions, and I am passionate about integrative medicine. So these are my two girls. My story is that my family had a lead exposure, and that was something that I didn't get a lot of resources for, had to figure out on my own. And so that was an important part of my journey to doing integrative medicine. Okay. So our discussion tonight is really close to my heart because I'm finishing my doctoral work on studying how infections impact the symptoms and signs we see in autism. So if your child has symptoms of ADHD, anxiety, depression, bipolar, any behavioral challenges or diagnoses, these are things that we can help with. If your child has been prescribed psychiatric medications or has had a bad reaction to medications, these are also things that we can work on. Okay, get that flowing. Okay.
Your child age, are you going from 1-year-old up, or do you have a range you're talking about here?
Yeah, so when we talk more about PANDAS, we'll talk more about the age range with that, but it generally is something we kind of start to see in school-age children, and part of that is because when kids are going to school, they start having more expectations about behavior and what's expected of them, and so we can start to notice when kids aren't as much like their peers. That's when these things start to become more obvious. That's when kids may start to get a diagnosis and be either recommended to take medications that they maybe don't do well with, or that just seem like a bad idea. So many medications can have undesirable side effects. For example, anti-anxiety medications like Xanax and Valium have been linked with Alzheimer's later in life. Many psychiatric medications are linked with diabetes and problems that go along with that. So these are things we want to avoid if we can by figuring out what's really going on. Okay. So our mission is really quality of life, really helping kids have the best chance that they can to live the best life that they can. So we want to find and fix root causes. There are reasons for behavior. We're not hyper or fatigued or anxious for no reason at all. What's going on in the body affects the way we feel, and we can impact what's going on in the body, not just by pharmaceutical medications, but by what we eat and with supplements, by cleaning up our environment, and by treating infections, which we'll talk more about. Okay. So a little bit of fine print. So this information isn't medical advice, and we do recommend that you work with a provider to figure out what's best. The medications and treatments that we talk about here may or may not be FDA approved, and we may be talking about them in terms of off-label uses. So again, work with a provider. And this may or may not reflect MD Custom's opinions. Okay. So there are many things that can contribute to behavior problems. That can include infections, which we'll spend a good bit of time talking about, environmental chemicals, so those can include things from pesticides to plastics. Heavy metals in the environment can be an issue. Most common one is lead that can be found in water, but there are others, of course. Toxic mold is linked with behavior problems, linked with Alzheimer's, which obviously has an important behavioral component. Head injuries, family history, and more rarely, but still worth mentioning, are tumors and seizures that can drastically impact behaviors. Okay, so a quick example from the animal kingdom of how infections can impact behaviors. So ants who are infected with flatworms do something they don't normally do. They crawl up to the top of a blade of grass. Normally ants stay on the ground. But that's where a grazing sheep is most likely to eat the ant. So an ant gets eaten by the sheep, and the flatworms that are inside the ant then are able to, inside of the sheep, reproduce, lay eggs, and complete their life cycle. So the thought is that that the infection can really drive the ants to unusual behaviors. So then the sheep will defecate and release the ant, or release the flatworm back onto the ground, where again it can infect the ant, and so on and so forth. Okay. But how can an infection affect mental health? There are a lot of bacteria, viruses, fungi, and parasites that can affect behavior. So this is not a complete list. We have this slide and the next one. But a basic example of how infections can change behavior is causing what's known as sickness behavior. So infections cause fatigue, which encourages self-isolation. People stay in bed, they don't go out and socialize, which is a measure that the body takes to prevent the spread of infections. This is fine for a little while, but obviously not long term. So we will discuss strep and Lyme disease in more detail. The terms walking mycoplasma and chlamydophila refer to what you may know of as a walking pneumonia type infection. The retrovirus example is that with HIV, more than half of people will get dementia along with that. So an example of how an infection will affect behavior and mental health. Okay. So more infections that can affect behavior. So Candida and toxic mold we'll talk a little bit more about later. Toxoplasmosis is a parasite that's linked with schizophrenia, ADHD, obsessive compulsive behaviors, and the way that it's thought to do this is by raising dopamine levels. And this occurs through processes we'll talk about later, including inflammation and altering neurotransmitters. So excessive dopamine is associated with poor focus, anxiety, restlessness, agitation, paranoia, and even hallucinations. So this parasite is often contracted through contaminated food, cat excrement, and can be transferred from mother to baby. So infections can release neurotoxic metabolites, and these are things that we can test for. As the bacteria and other infections have their own metabolism inside of our bodies, they release chemicals which then we can detect. So this is a urine test that we'll run that will show markers for things like yeast and Clostridia, which is the bacteria that can cause what's most known for C. difficile, which is known for as a hospital infection that can cause diarrhea. Okay. So infections can also affect behavior through altering neurotransmitters. So I mentioned dopamine already. Other neurotransmitters also affect moods, behaviors, sleep, hunger, and focus. And probiotics are an example of something that can help with controlling neurotransmitters, and that's how they're thought to be able to affect mood. So another way that infections affect behavior is by triggering inflammation. So this inflammation can cause fatigue, It can, its main job is to kill the invaders and protect you. So inflammation is healthy in the right amount and when it's temporary. But when inflammation is chronic, it goes on too long, there's too much of it, then it can cause severe problems that can affect behavior and cause other issues. So here are two studies of many that show the links between inflammation and mental health problems. Okay. Integrative medicine tools are especially helpful at reducing inflammation. We have a lot of options here, and that's really an area where we have different things that we can do. So infections can also enter the central nervous system. So an example is that streptococcal infections that live in the nasal passages can actually get through the blood-brain barrier and go right into the nervous system and affect the brain. So infections can get in through breathing them in, through swallowing them. They can be transferred from mother to baby. And the problems can start at any point because of this. So a big process that occurs here is molecular mimicry and autoimmunity. So the way that this is supposed to work is that in normal cells in our body, when pathogens try to attack that, so an infection, a bacteria or a virus starts to attack our body, our immune system sends out the army, and the army overwhelms that pathogen. But what can actually happen then, particularly if that pathogen looks similar to the body's own cells, is that the immune system can attack its own tissue. Okay, so another description of how that can happen, and particularly an example of how this happens in the nervous system. Okay. So this is how the information on the next few slides that we're going to talk about is organized. So PANDS is Pediatric Acute Neuropsychiatric Syndrome. It's a very general term. And this breaks down into more specific terms. So PTANS is an infectious trigger of sudden neuropsychiatric syndromes, and strep is a particular version of that. We'll talk about all the other potential triggers. Okay. So this is the criteria for PANDAS. So PANDAS is really a clear strep infection plus neurologic signs such as hyperactivity, motor tics, and other movement disorders. And then also psychiatric signs such as obsessive thought patterns, behavior rituals, the things that can get our kids labeled as psych patients when there's a medical problem. So PANDAS, just again to define, is pediatric acute neuropsychiatric disorder associated with a streptococcal infection. So it's an acronym, and it's really something that that takes kids from being, relatively average to appearing like a psychiatric patient overnight. So if a provider has never met the kid before and they don't know what they were like before, that's some of where the issues come in with kids getting labels that aren't necessarily appropriate. So this was recognized due to knowledge of Sydenham's chorea, which the other name for this is St. Vitus dance. You might have heard of that. as something that's associated with rheumatic fever. This has been recognized since the 1800s as psychiatric changes that can occur because of an illness. Okay, and it is something that's known and established. The treatment guidelines that your provider might use or have were only published in 2017, so they may not use them, they may not know about them. And this, even though this has been something that's been emerging over a much longer period of time. Okay. So PANDAS again is other infections besides strep that trigger this phenomenon of kids appearing to become psychiatric patients essentially overnight. So it's pediatric infection-triggered autoimmune neuropsychiatric disorders. Okay. And PANDAS is the most general term. So it's pediatric acute neuropsychiatric syndrome. No discussion about the cause in the title. So the most common symptoms are abrupt onset of obsessive compulsive type behaviors or restricted food intake. And going along with that are neuropsychiatric syndromes, neuropsychiatric symptoms from at least 2 of 7 categories. And these are the categories. So this can really include things like anxiety, emotional changes, severe mood swings, depression, irritability, aggression, oppositional behaviors, regressive behaviors, seeming younger, doing behaviors that they did when they were much younger. Changes in school performance, sensory issues, becoming sensitive to lights, noises, having movement changes, motor tics, twitches, things like that. Sleep changes, and then urinary changes are another common one. Okay. So this is really a clinical diagnosis based on the story of what's going on with the kids, but we do have labs that we can do as well. So this is the Cunningham panel, and this is a blood test that determines, that measures antibodies against the body's own nervous system. So it measures the body's attack on the nervous system. Okay. ASO and DNASE-B are common labs that can be ordered through any Quest or LabCorp type company that doctors commonly use. And they are commonly covered by insurance. So the thing to note here in these examples is that there's a range of what's normal. So this first one is an example, somebody who didn't quite reach the limit, but the symptoms were clear. And so that's somebody who would warrant taking this situation seriously rather than being dismissed as a psychiatric patient. Okay. And then the other thing to notice here is that the references of what's normal can change from lab to lab. So somebody can have a number and be normal in one lab and not in another. So that's why we always have to take labs along with the child's symptoms. Okay. Conventional treatment starts with antimicrobials. So being integrative, we have a full toolbox of both pharmaceutical antibiotics and herbal products as well that we can use. Tonsil and adenoid removal is often recommended, especially when strep is a clear cause. That being said, tissue can grow back, and that doesn't always get rid of the strep. Steroids are often recommended to calm down the immune system and to stop the body's attack on itself. Our approach, though, is really to support the immune system rather than suppressing it. IVIG, immunoglobulin supplementation through IV can be helpful for many kids, but again, we also need to support and rebalance the immune system along with that, we've found. And then plasmapheresis is really considered an extreme measure. It's one that's done in a hospital, often in intensive care. Okay. So there is quite a bit of research emerging on IVIG. Insurance companies have very specific criteria for covering this, though. And at this point, PANDAS is not a reimbursable diagnosis for this. So IVIG can be used if testing shows that the immune system has low function, but at this point, it is not specifically used for PANDAS triggered by other situations, such as Lyme disease, for example. Okay. So more studies on plasmapheresis being something that can be helpful for this autoimmune process. Okay. So Lyme disease is an infection of the Borrelia burgdorferi bacteria. Post-treatment Lyme disease syndrome is when Lyme disease was treated, but symptoms continue. If a child has never had symptoms of Lyme, they may get labeled with depression, anxiety, ADHD, pain, headaches, fatigue, and a variety of autoimmune disease rather than being identified as having Lyme disease. Lyme is associated with psychiatric issues, and so that's why the term PANDAS also includes Lyme disease. Lyme is also linked with Alzheimer's. There have been examples of people being treated for Lyme disease and the Alzheimer's improving. Lyme disease is quite controversial, though. The diagnosis for this is based on symptoms, the response to treatment. So, for example, if a patient has symptoms that seem to get worse before they get better when they start treatment, that's known as a Herxheimer reaction or die-off, and that's a clue that's commonly identified with Lyme disease. So treating infections may involve pharmaceuticals. So different antibiotics are used for different infections. But it can also involve herbs. So we have a wide variety of options that we can use here. Other contributors to, so other ways that we can really support and support the immune system and reduce autoimmunity include low-dose naltrexone, which is a prescription that can be obtained right here from a compounding pharmacy. Transfer factors, which is a supplement that's available over the counter, and antigen therapy, which can help calm down the immune system's reaction to the pathogen. Okay. So other contributors to PANDAS, non-infectious triggers, can include chemicals and heavy metals. So for example, lead is specifically associated with prison populations. Mold illness. Mold has specifically been implicated in Alzheimer's disease. And we actually see brain changes in patients who are exposed to water-damaged buildings. Head injuries, really important thing to identify, big or small. So there's significant research on how head injuries can impact and change behaviors, even violent ones. So even something like a large roller coaster has been shown to cause mild concussions and mild trauma to the brain. Family history. So it's something that can contribute to mood and behavior. It's well known that mental health patterns run in families. But even when it's an issue that's been in a family for generations, we can interrupt that cycle, and not just with pharmaceuticals. We have all of the options that I've started to mention, and some more that we'll talk about can affect family patterns and change them. We know more than ever about the processes that are occurring in our brain, and these processes that can go along with family history. And this knowledge gives us the opportunity to really change the direction of that pattern. Okay. It's not common, but we have to mention that space-occupying lesions in the brain can cause brain changes that affect behavior. Seizures. Seizures can actually be subtle at times, and something that's not easily identified. It may be something like a report that a child's not paying attention in class. Daydreaming and staring off can be missed as something that can be a small seizure. Children with an ADHD diagnosis are 2.7 times more likely to have epilepsy than children without an ADHD diagnosis. Okay. We can look at the brain, see what's going on. SPECT scanning measures blood flow to the brain. SPECT allows us to see the interaction of function or symptoms and quality of life with form, the blood flow to the brain. Dr. Daniel Amen is a psychiatrist who says that psychiatry is the only medical specialty that doesn't look at the organ it treats. SPECT allows us to identify the best treatment. For example, it helps us answer questions like, why do some people with ADHD get better with medications like Adderall and others get worse? Okay. By insurance? Generally not, but of course it's always the insurance company's decision whether or not that's warranted. So additional options for supporting neurotransmitters and reducing inflammation, of course, include diet. Different diet options are better for different people, so diets really do need to be personalized. Amino acids, herbal treatments, and then CBD oil. So treating infections, killing bugs in the central nervous system, getting rid of toxic chemicals that infections produce can improve current issues like anxiety, GI problems. Reducing autoantibodies and inflammation also allow the neurotransmitters to heal. For example, amino acids. 5-HTP is the amino acid precursor to serotonin. And this is one that we can use to support serotonin levels. Theanine is the calming component in green tea. It's the reason you can drink tea with caffeine and not get jittery like you do with coffee, because it has a calming effect. CBD oil is legal in all 50 states. It can support the endocannabinoid system, which has a role in mood and immune function. So an anti-inflammatory mood-supporting diet is low in sugar, high in vegetables and other foods that give us nutrients, high in good fats, organic, often gluten-free, occasionally dairy-free. But again, everybody's a little bit different as far as what they need. And important point here is that our brains need good fats. So that is something that we will check to make sure that kids are making the cholesterol that they need to help the brain run. Okay. So additional options that we have to support the immune system and support the body's own detoxification processes. Okay. So these are labs and history from an 8-year-old boy with anxiety, an ADHD diagnosis, an immune system deficiency, and a history of frequent infections, including strep throat, ear infections, sinus infections, upper respiratory infections. He did receive a dose of IVIG because of the immune deficiency that was found, and it was somewhat helpful. This all happened before he became a patient with us, and he came to us having been prescribed antibiotics for a year after the IVIG. He still had a lot of separation anxiety and a lot of sensory issues. He avoided loud places, which meant he had trouble in school, going to events. He had light sensitivity, and his hair hurt when he dried it with a towel after his shower. He was fatigued. He had very low muscle tone, which made it hard for him to play and participate in events with other kids. He reported abdominal pain and showed distension. So we were able to detect some additional gastrointestinal infections, and we actually found that he had celiac disease. So we know that when there's one autoimmune process going on, that can affect many other parts of the body as well. So with finding these infections and autoimmune processes, his symptoms have started to improve. So you have options. There are many choices, many avenues to pursue, many things that can be going on. Never give up, and we're here to help you figure that out. Questions?